Imagine walking into your barn and finding your horse with long ropes of saliva hanging from its mouth. The muzzle and chest are soaked, the bedding is wet, and a puddle is forming on the floor. It looks frightening, but one possible explanation is a condition known as Clover Slobbers. Today, we are going to explain what Clover Slobbers is, what causes it, how to recognize it, whether it is dangerous, what to do if you suspect it, and how to reduce the risk of it happening again. We will also discuss the warning signs that suggest the drooling may be caused by something more serious. Clover Slobbers is excessive salivation caused by slaframine, a toxin produced by a fungus that can infect clover and certain other legumes. The veterinary term is slaframine toxicosis. The condition is usually temporary, and most horses recover after the contaminated forage is removed. However, the amount of saliva can be extraordinary, which is why the first sight of it often causes owners to panic. The clover itself is not necessarily poisonous. Healthy clover can provide horses with energy, protein, and fiber, and it is commonly found in pastures and hay mixtures. The problem begins when susceptible forage becomes infected with a fungus associated with a plant disease called black patch or black spot disease. The fungus is commonly associated with red clover, although other legumes may occasionally be involved. It produces slaframine, and when a horse eats the affected plant, the toxin strongly stimulates the salivary glands. In simple terms, it turns on the horse's saliva tap. Cases are often associated with wet or humid conditions that encourage fungal growth. Dark spots may sometimes appear on the undersides of clover leaves, but affected forage does not always look obviously dangerous. Horses can develop Clover Slobbers from pasture, but they can also develop it from hay. This is important because slaframine can remain active after the plant has been cut and dried. Moving a horse away from a field will not solve the problem if it continues eating hay made from the same affected forage. The most recognizable symptom is sudden, profuse drooling. This is not the small amount of moisture or foam that may appear around a horse's lips while eating or works in a bridle. Saliva may pour from both sides of the mouth, hang in long streaks, soak the chest and forelegs, saturate bedding, and form puddles beneath the horse. Signs can begin within hours of eating contaminated forage. Some horses show little more than salivation, while others may also have watery eyes, frequent urination, diarrhea, reduced appetite, or mild abdominal bloating. Several horses may be affected at the same time if they share the same pasture or hay. If multiple alert horses begin drooling after a new bale is opened, or after entering the same clover-rich field, a forage-related problem becomes more likely. There is no simple visual test that confirms Clover Slobbers at the barn, so a veterinarian will consider the history, examine the horse, and rule out other causes. Most uncomplicated cases are more dramatic than dangerous. Death is not typical, and many horses improve within 24 to 48 hours after the contaminated forage is removed. In some cases, the signs may take several days to disappear completely. The main concern is fluid loss. A horse producing a tremendous amount of saliva can become dehydrated, particularly during hot weather or if diarrhea is also present. Owners should monitor whether the horse is actually drinking and not merely standing near the water source. But there is an important warning here. Excessive salivation is a symptom, not a diagnosis. A horse with choke, which is an obstruction in the esophagus, may also drool heavily. It may stretch its neck, cough, gag, make repeated attempts to swallow, or discharge feed material and fluid from its nostrils. Choke requires prompt veterinary attention because material can enter the lungs and cause aspiration pneumonia. Drooling can also result from dental disease, a mouth injury, a foreign object, an irritating substance, or a neurologic disorder. Look at the whole horse. Can it swallow and breathe normally? And is it bright and responsive? Call your veterinary urgently if the horse has difficulty swallowing or breathing. feed or water coming from the nostrils, severe coughing, weakness, stumbling, facial asymmetry, fever, signs of colic, suspected chemical exposure, or rapidly worsening symptoms. Do not place your hand blindly inside a distressed horse's mouth. A frightened or painful horse can bite, and an unseen object could injure you. If Clover Slobbers is suspected, the first step is to stop the horse from eating the suspected forage, remove it from the affected pasture, or take away the questionable hay, and prevent other horses from eating the same source until you have received professional guidance. Next, contact your veterinarian. Explain when the drooling began, what the horse has eaten, whether it can swallow, and whether other horses are affected. Provide clean, fresh water unless choke is suspected or your veterinarian instructs you to withhold it. If the horse may have choke, do not offer food or water while waiting for your veterinary advice because it may increase the risk of material entering the respiratory tract. There is no specific antidote routinely used to eliminate slaframine. Ending exposure is the essential step, and veterinary treatment is supported when needed. Keep a sample of the suspect forage if your veterinarian recommends testing, and record which field or hay lot was involved. Continue monitoring the horse even after the drooling begins to decrease. The horse should remain comfortable, hydrated, alert, and able to swallow. A drier mouth is encouraging, but new coughing, nasal discharge, fever, loss of appetite, weakness, or colic signs require further veterinary attention. To reduce the risk, inspect clover-rich fields during wet or humid weather. Improved drainage and thinning dense stands may encourage airflow and make conditions less favorable for the fungus. Because red clover can take longer to dry, proper hay curing and storage also matter. Keep track of hay deliveries so a questionable batch can be identified quickly. Do not assume that suspicious hay will become safe simply because it sits for a few days. Slaframine is relatively stable in dried forage. Although toxin levels may decline over time, waiting is not a reliable home treatment, and hay connected to a case should not be reintroduced without professional advice. So, what should every horse owner remember? Clover Slobbers is caused by a horse eating fungus-infected clover or another affected legume containing slaframine. It may come from pasture or hay. The classic horse drools heavily, but remains alert and able to swallow. And most uncomplicated cases improved after the contaminated forage is removed. However, a horse that cannot swallow, has feed coming from the nostrils, struggles to breathe, appears neurologically abnormal, or shows severe distress, may be experiencing something more urgent. When in doubt, call your veterinarian rather than assuming the cause. Finding a horse standing over a puddle of saliva is alarming, but knowing what to observe can turn panic into a clear response. Assess the whole horse, stop exposure to suspect forage, protect the horses, provide water when appropriate, and seek veterinary guidance. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing. And also remember, I am not a veterinarian, and always consult your veterinarian when in need.